Hello everybody, my name is Mona. Welcome to another video of this week. So I'll be talking about another scenario I haven't seen so far. So I'll be talking about a 38-year-old lady that's being treated for schizoaffective disorder. So it's like a depressive type of schizoaffective disorder. Well, I haven't experienced this disorder in real practice. This was the first time I experienced it. Then it hit a very significant impact on my understanding as a role of the psych nurse MP. So this patient actually rekindled the fact that proper assessment is very important as a psych nurse MP, because this patient was experiencing two different problems: a mood problem, which is like a depression, and a psychotic problem, which is psychosis. She was depressed at the same time she was psychotic. She was hearing voices, she was seeing things. So, combining these two categories of problems made it very challenging to like describe what the patient was actually passing through. This made me to understand that sometimes diagnosis could require a little more timing to be established, a little more timing to be established. Before then, I thought that psychosis was a different thing and depression was actually a different thing. I never knew that psychosis with depression could a kind of overlap. So this made me to understand that depression with psychosis could overlap, and in such condition it might be very a little bit challenging to understand the role, a bit challenging to get diagnosed. So building relationship with this patient, at first the patient was like a kind of very guarded, and she was like a kind of very stiff. So it reminded me the importance of being calm, being not being judgmental, and being an active listener. At the point the patient recognized that I was able to like acknowledge her feelings were valid, she became a little bit open to me. Then I was able to get as much as more information I could gather from her to generate my diagnosis. So talking about my strengths and challenges, my strengths and limitations. Talking about my strength, I was a kind of calm. I have good and listening, active listening skill. I was not being judgmental. This made the patient to, this provided like a safe place for the patient to open up and talk to me, tell me what she was going through. So talking about my limitations, I was a kind of like afraid. I wasn't confident enough to ask questions regarding to hallucinations and delusions, because sometimes those questions could be like a little bit judgmental. So I was a kind of like not confident enough. Also, I wasn't very confident in diagnosing or deducing a diagnosis I wasn't very sure of. This was my limitations, but in all, I had a preceptor that helped me to like figure out one thing or the other. So, talking about therapeutic use of self, I was able to use body language, empathy. I tried to validate patient's feelings and patient concerns. So, by that way, patient was able to build trust. I was able to connect with the patient. So, this made patient feel safe, and the patient, I asked the patient what had made her to cope during the time she was having these symptoms. How has she been able to cope and all that? Patient was able to give me more information of her coping skill, of how these things has been happening. So well, I went ahead to tell the patient that these things she's seeing, hearing, were not real. I also went to the point like asking patient what she was seeing and what she was hearing. So by this way, I was able to connect to the patient. We were able to like build a strong rapport to manage this scenario. So talking about how this is gonna be helpful to me in future as a psych nurse MP. So in future, I'll be able to know that to diagnose a disease condition might not just be on one contact. it might take a little bit of time, because sometimes you need to like ponder over it. You need to like think about it. You need to like, you know, think deeply about it before a diagnosis can be deduced, because there could be like multiple, there could be coexisting symptoms that could make diagnosis a little bit hard to diagnose. Also, in future, I'll be more confident in asking patients about psychotic symptoms, because it's very important to know actually what symptoms they are passing through, because people hearing voices could go as far as having like a kind of suicide. So it's very important to actually know exactly what they are passing through. Also, you know, showing in future or at all times, I would like to show empathy to my patient, because that way I'll be able to connect with the patient. That way I and my patient will be able to figure out things, will be able to feel safe, to talk about things going on. Thank you very much.